Hi everyone, my name is Brenda,
And I'm Fran.
and we have the Asthma and Allergy Foundation of America. So, some signs and symptoms of allergies can be local or systemic. The local signs and symptoms of allergies are sneezing, congestion, hives, water eyes, swelling. That's a lot of the day to day of a lot of us in our cohort experience. I know I have allergies and I experience all of those things on almost a day to day basis. And then some systemic signs and symptoms can be the inability to breathe, passing out, seizures. That's a bit more severe, more concerning. And then for asthma, the mild signs and symptoms are slight shortness of breath, chest tightness, and wheezing. Severe asthma signs and symptoms are dyspnea, flaring nostrils, and cyanosis.
Nice. So the diagnosis for allergies would be a patient history review, along with a physical exam and then an allergy test, which we know and have seen. It's like those little pricks on the back, and then you come back and see how they flare up. And then the diagnosis for asthma would be similar to allergies, but it's a lung function test. And then it's also a chest and sinus x-ray.
And then the treatment for asthma is those inhalers, those short-acting beta agonists, and they are commonly used in the long term um, when symptoms begin to present. And then allergies, I have actually some medication, and it's over-the-counter generic from CVS. It's an antihistamine. And also generally treatment for both of these is to avoid triggers. So know your triggers and to avoid them. That's a big one for both of these.
And then some of the PTA implications would be just knowing what asthma or an allergy kind of flare up looks like. So knowing the signs and symptoms, and even if it's a patient who's undiagnosed with asthma or allergies, just know that if they are having some onset symptoms, know to put them in that Fowler's position. And then if they do already have an inhaler, then you would tell them to self-administer that, and then also just help the patient relax. Relaxing like your upper chest area when it gets tight due to an asthma attack is super important. And then if your patient does end up having or going into anaphylactic shock, then that would be the time to call 911.
And then the prognosis is great if you have the right care.
So then some highlights from the Asthma and Allergy Foundation of America is on their website, they have a bunch of different opportunities to volunteer. You could also make donations on there, and then you could also fundraise, so coordinate an event to help fundraise for the Asthma and Allergy Foundation. And all this just helps them raise money for the awareness of this condition.
And then a couple of things that I learned from the Asthma and Allergy Foundation website is that some risk factors for asthma is poverty, bad air quality, and lack of health insurance. And I know, at least for me, poverty wasn't something that I considered a risk factor, but it totally is, since people who are in impoverished areas, those are the areas that are most likely have bad air quality. And something else that I didn't know also is that the global warming causes longer allergy seasons and increases air pollution. And these things just blow my mind because these are also all things that we actually can vote on. Um, and that would be great, not only for us, since all of us, a lot of us experience allergies or maybe even asthma, but also for our patient population, especially that more vulnerable patient population, since asthma doesn't affect more people who are in poverty, and there are also racial disparities. So a part of patient advocacy is also voting. Go ahead and vote to increase air quality and expand healthcare, or to even have better healthcare, and also against global warming. And thank you.
Thanks.
And we're done.